see needles on the street that we never saw before.
We're seeing overdoses. We're seeing families that are getting torn apart.
We see children are not being fed properly.
It's just not a large town or a large city problem. It's a very much on the rise in all of our small communities.
I just want to let you know that everything you say in here is completely confidential. I'm Shauna, and I'm a registered nurse right now working with CAMSAC Public Health. Any IV drug use in the past or anything?
Yeah.
Okay. CAMSAC is a nice, small, little prairie town. We're quite rural in terms of where we're located. We are seeing clients struggling with addiction. We are seeing clients struggling with accessing resources to assist with those addictions.
So I'm Sheila. I'm your nurse today.
The thing that's causing us the most turmoil right now in CAMSAC is the opiate and crystal meth addiction.
Any pain in your chest?
Somewhat, yeah.
Okay, I'm just gonna listen.
We were seeing a lot of overdoses, injecting drugs, sharing needles, so the HIV and the Hep C numbers go through the roof.
Recently started using some drugs lately.
I see people coming in that are actively high on medications. Any shortness of breath. We're seeing a lot of mental health issues being presented. We don't have mental health counselors. We don't have addictions counselors.
It's a crisis across the board in this community. We have people from all income levels, all age levels, all genders, everybody.
Addiction can cause marriages to break up, parents to lose their children, loss of employment, and in some worst cases, death.
As a doctor working in rural communities, I've seen the rise in addictions and mental health issues. We are definitely dealing with a crisis, and one that isn't limited to large cities.
My name is Claire, and I've been a student services teacher in small town Saskatchewan for 38 years. I think that in our schools today, it's very overwhelming to deal with the number of mental health issues that present themselves on a daily basis.
That, because we used to be in the school. We talked a little bit before that historically there was always a school nurse, right?
I feel that many children are coming to school now with the weight of addiction. By weight of addiction, I mean that they are carrying perhaps the trauma from home, from an aunt, from an uncle, from something that's happened. It is killing people.
It is.
And it's ripping families apart.
Yeah.
So, like the kids that we see at school are sometimes just, surviving from one moment to the next. Our students suffer, and we need the resources to help deal with those traumatic events.
Because I'm sure you have students every day that some of the only meals that they get is here, right?
Oh, yeah. Mental health issues, if left unaddressed, particularly in youth, in my experience, can lead to addiction and some very impulsive behaviors that will not be successful for that individual or for the community.
One of the greatest needs in rural and small towns is greater and more accessible resources. They need to have access to mental health and addiction supports.
It would be wonderful to have mental health nurses and psychiatric trained professionals come out, even on a semi-regular basis.
Early intervention is really important. It's not about intervening once things have started. It's about prevention. Early intervention equals prevention.
Can I put the leads on you and let's just see what your heart is doing, okay?
Okay.
The team of experts able to help with mental health and addictions may include registered psychiatric nurses, social workers, addictions workers.
I think we need to be offering perhaps a psychiatric nurse or a mental health nurse right in our emergency room or in our hospital.
And just to make sure we keep you safe and others around us, I just want to make sure, have you considered suicide lately? No. If you had a heart problem, you would be seeing a cardiologist. If you're having an addiction problem, you need to see someone that specializes in addiction.
And they hit rock bottom. They gotta go somewhere where they can get help immediately. And
one of the solutions that we need here in Kamsack or any small town is the access to the detox center, access to an addictions counselor, a psychiatric nurse, and aftercare. You know, aftercare is not happening. You have people going off to rehab centers in the city, and they come back, there's no aftercare.
I feel that small town Saskatchewan needs to address the harm reduction strategies that are being used successfully in larger centers.
Oh, but we're gonna have to circle the block because I had somebody behind me.
We talked to them about getting tested.
Yeah, they thought they were gonna phone next week.
We know here in Kamsack that Saskatoon and Regina have mobile crisis units.
Are you using drugs right now? Yeah. We are lucky enough that we have a van that we can go out and see our clients with. Well, my name's Patty, this is Laurel. We're both registered nurses with a program in Regina that has harm reduction supplies. Everything that you can come to us for in the clinic, we can do in our van.
Single use and they're sterile, so.
These mobile units don't just belong in the city. They belong out here in Saskatchewan, in small towns. We have lots of small towns in our area. We could share these units. They don't have to be in one small town all the time.
Okay, so when we're talking about drug use, you know, how much you have them per day?
About 3 or 4 eighths per day.
3, 4 eighths. What we know, what works, is meeting the patient where they're at, and sometimes that has to be flexibility on the part of us as nurses.
Okay, so have you been tested in the past or recently for?
Not recently. One of the solutions we've looked at as a council is asking the Public Health Department for a safe injection site. That way the needles stay in one place, they're dealt with properly, and they don't end up on our streets.
If they're not using safely, it has a negative impact on the individual. It has a negative impact on their family members, on the communities. It has costs. The costs are financial, they're personal, they're medical costs, healthcare costs. So the safer that we can ensure people are using while they're getting treatment for their addiction, the safer it is for themselves and everyone around them.
Generations, right?
Yeah.
And maybe now that the conversation's starting to happen, it maybe is a step forward for not only our community, but possibly the other smaller and remote communities across the province too.
Having access to mental health and addictions experts can bring hope and support to small communities.
I feel at the end of the day, everyone deserves a chance to be saved. So if it's your son, your daughter, your wife, your dad using, do they not deserve a chance to be saved and have these resources available?
We need to come together as a community to support each other, to find the resources, to get the help that we need, and to look after each other.